Hi, my beauties. My name is Dr. Stefani Kappel and I'm a board-certified fellowship-trained cosmetic dermatologist in Newport Beach, California. And today I wanted to do a video on Kybella because it's my very favorite fat-reducing treatment that we do in the office. It's fast, it's easy, it's safe, and it's effective, and we've been doing a ton of it in our office for everybody getting ready for the spring and summer. So I wanted to dedicate a video today on that treatment. And my last video with body contouring treatments included Emsculpt, which is another favorite in-office procedure of mine. So I'm a minimally invasive, non-surgical cosmetic dermatologist. So everything that we do in the office is non-surgical and minimally invasive, and that's why I love Kybella. So before I move on, I ask that you like and subscribe and share this channel with anyone who would find it useful or anyone who wants non-sponsored content from a board-certified dermatologist. And I'm doing this video from Cabo. I'm in Mexico, and how to find a safe, quiet place for me to sneak away and do this video. So as the sun moves and I try to seek shade, I may have to change the area where I'm filming this because I don't have my ring light and my tripod and all of the things that I usually have. I don't have my mic, so I'm basically just on AirPods in a hotel room propping my phone up on these like bamboo wall things. So anyway, thank you so much for watching, and hopefully after watching this video you'll know a little bit more about Kybella and why I prefer it over some of the other in-office treatments that are minimally invasive for body contouring and fat reduction. So Kybella is just an injectable fat-reducing substance. It's deoxycholic acid, and it's basically the enzyme that we have in our bodies naturally to break down fat when we digest it in the GI tract. And what it is it's an injectable solution that dissolves adipocytes, which are the fat cells. And the cool thing about that is that once those fat cells are destroyed, they can never grow back. If you have fluctuations in your weight with different changes in your diet or your exercise regimen, sometimes the existing fat cells can get bigger or smaller, but you can never make new fat cells. So once Kybella has its results and you maintain, your same body weight and status, it will never change, and your results are permanent pretty much and very long lasting. So that's an added bonus of Kybella. Another added bonus of Kybella as an injectable is that it's a very even, very smooth, very natural looking result. Liposuction can sometimes have undulations or irregular distribution of the treatment because your surgeon's going in with a cannula and sucking out fat kind of like in a streamlined motion with a cannula. So you get these like undulations, and I have a lot of patients who get referred to me to kind of laser that area or spot treat with Kybella areas where liposuction was uneven or left uneven areas of fat, and sometimes too much fat was taken out juxtaposed to an area where fat wasn't touched at all, and you get these kind of wavy undulations. So you don't get that with Kybella, and as a matter of fact, we usually use Kybella to kind of fix those irregularities that you can sometimes see with liposuction. I'm trying to get away from the sun, guys, but I need to make this video fast so that I can stay in the shade because this is the only area where I can prop my phone up. So moving on, another treatment, another benefit of Kybella is that it's quick and it's easy. It's in the office, it's really no pain or downtime after the treatment. During the treatment, I always say it's like a crescendo decrescendo. It's like a pain, little burning sensation, usually 4 or 5 out of 10 on the pain scale, and then it goes away. And it's usually, lasts within minutes, maybe 2 to 3 minutes. People usually say, like I said, about a 4 or 5 out of 10 on the pain scale, so it's not that uncomfortable. And then after you leave the office, usually bruising isn't an issue. Sometimes swelling can happen, but it's very minimal. Only you would probably notice it. Somebody else probably wouldn't notice it if you're walking around with the area exposed that had Kybella. The swelling is not really significant. So the downtime makes it really easy and a great treatment option. The only downside to Kybella, besides the discomfort that is actually still very tolerable during the treatment, is that there's a delay in the results. So it usually, will start to manifest results about 6 to 8 weeks after the treatment. So it's not like you walk out of the office and your fat's melted and your body is contoured. It takes about 6 to 8 weeks, and sometimes multiple treatments are needed. When we use Kybella for under the chin, which is a very common area, and that's what it's FDA approved for, more treatments are usually necessary, usually 2 to 3 treatments. Depending on how many vials are used and how much adipose tissue or fat is there. That can vary patient to patient. But when you're talking about body contouring contouring, I would say typically 1 to 2 treatments are needed versus 2 to 3 treatments for the submental or double chin area. And when doing body contouring, typically patients will come in and they'll have their treatment, and then they'll wait about 6 to 8 weeks, and they'll come back and they'll get their second treatment. And I would say only 10% or less people would need a third treatment. And I would say it's 50-50 how many people need 1 versus 2 treatments. And also, beauty's in the eye of the beholder. Sometimes people have 1 treatment and they're like, man, I love these results, I'm happy with it. Sometimes people are like, I love it and I want more and I want it to be perfect, and then they'll do a second treatment. So it just depends on the goal and the outcome that you're looking for. And then the most common areas that we use Kybella, I would say, aside from, the double chin area and contouring that lower, lower jawline area for fullness in the submentum or the double chin, includes on the body bra fat, which is like right up here, you can't even see, bra fat, back fat, kind of around the waist area, the midsection, the lower abdomen, medial thighs, and the area that I'm seeing more and more people wanting is the knee, like around the knee, above the knee, in the medial knee. For some reason, as we get older, the fat distribution in our body changes, and these are the areas where we see more adipose tissue. So it's kind of like a survival mechanism. Your body wants to hold on to fat stores, in case of a time of feast or famine or starvation, and that's, everybody has a genetic predisposition to where they're going to hold on to the fat. Sometimes it's in the abdomen, sometimes it's in the bra fat, the back fat, but the bra fat, back fat, and knee fat are areas that we see fat distribution change as we mature and we get older, and those are the areas that people usually are coming in for Kybella, and it works really well for that. And you don't have to go under the knife, you don't have to undergo anesthesia, you don't have to worry about a regular distribution of the fat after like liposuction, you don't have to worry about those liposuction scars. There's no scarring, very even results, very predictable outcomes, and very happy patients. So I've been doing Kybella a lot in my office. I've done it on myself. Dr. Kennedy has treated me. I've done the sides of my waist. I've done my bra fat, my back fat. I haven't done the medial thighs or my knees yet, but I'm sure that in the future that's probably in my future as well. So I really love it as a fat reducing treatment that's very effective, very safe, and people always ask what happens to the fat cells after they're lysed and they're destroyed, like how does your body eliminate that? It usually gets excreted in the urine, and there's no deleterious side effects from that or from that process of removal. So other treatment options when people are considering Kybella, they're usually also considering tumescent liposuction, which we've already discussed. Listen to the birds. And also they usually have been looking into, there's so many different devices out there, but the two main players in the game I feel are coolsculpting and M-Sculpt. And there's M-Sculpt Neo, which if you haven't watched my M-Sculpt video, take a look at that because I go into those devices, which can also reduce fat, but also work by inducing muscular hypertrophy and hyperplasia and reduce fat because the muscles are getting bigger and the metabolic intake of those muscles kind of reduce the fat cells. So I really love that kind of more natural induction of your body's own responses to give a body contouring result that's long lasting. And coolsculpting. So coolsculpting, I had a coolsculpting device for many years in my practice, and the thing with coolsculpting is that there's a lot of side effects with it. If you're the right candidate with the right amount of skin turgor, and you fit the profile for someone who would benefit for coolsculpting, it's usually a great treatment. However, I don't like to mess with coolsculpting anymore because I've seen way too many side effects, uneven treatment, distributions of fat reduction. There's some side effects that occur with coolsculpting that you don't have to worry about with Kybella as an injectable. You have to, when you have the coolsculpting treatment, you have to have the skin drawn within this handpiece, and the suction of the skin into this handpiece can cause skin laxity and can cause irregular skin texture after the treatment, which nobody wants, and especially I remember I even had coolsculpting after my second baby, and the skin laxity was horrible. I had to thermage, and now I'm going to probably do Elicor, but I had to thermage that skin on the abdomen to tighten it up after coolsculpting. And I'm not sure if it's the draw of the skin into that handpiece that sucks it in and stretches the skin out, or with the decrease in fat, you get more laxity and a texture regularity of the skin. Either one, I don't want to have to, have any of my patients have those side effects and deal with that. So I've pretty much adopted Kybella into my practice as, you know, my favorite fat reducing treatment. But I like to be all inclusive and talk about other players in the game in that space. When we're talking about Kybella, it's important to talk about, you know, other treatment options. But I would say Kybella and liposuction are a little bit more maybe significant if you have a lot of adipose tissue, a lot more significant results. However, I feel like the side effects and safety effect profile of those treatments make it less desirable than Kybella as an injectable. But definitely if you have a lot of adipose tissue and you need like a full-on abdominoplasty or tummy tuck or liposuction, and then we can fine-tune your results with Kybella, it also plays a role there too. But I'm not going to say Kybella is going to give the same results as some of those more aggressive treatments. It's definitely not, but I feel like it's a better fine-tuning, minimally invasive option with more natural looking results. And I have loved it. I've treated myself with Kybella for years since its launch, and it's been out for several years now, and there really isn't any side effect that we really have to worry about, which you can't really say that for very many treatments out there, especially for body contouring and fat reduction. So my approach to body contouring is, you know, live a clean lifestyle, live a healthy lifestyle, exercise as much as you can, eat as clean as you can, and when you get to your stable weight, there's little things that we can do. We could do M-Sculpt to augment your workout routine and your results. I mean, that takes it to the next level. And then doing Kybella to kind of fine-tune little areas where your body's holding on to fat where diet and exercise alone can't really reach. Or say your fat distribution is changing as you mature or you get older. You know, doing Kybella to kind of touch up those areas is really, really beautiful and a really a great outcome. But again, minimally invasive, non-surgical, the results are going to compare to surgery or something more aggressive. But on the flip side, it doesn't have the side effects, the risk, or the scarring that some of those more aggressive procedures have. So drop a comment in the comment section if I failed to mention something about Kybella or other fat reducing treatments that you guys want to hear about. I see you, I hear you. Of course, I give preferential treatment to my subscribers, but I'll answer all your questions and comments if I forgot something in this video. And be sure to like and subscribe and share this video with anybody who may find it useful or anybody who wants non-sponsored content. All right, you guys, thank you. I wanted to make a quick addendum to my Kybella video because we just went to breakfast and I watched the video before posting it, and I'm like, oh gosh, I need to make these 3 more points. The first point is, I think somewhere in the video I said that liposuction gives the same results as like surgery or a surgical outcome, or I didn't mean that. That was a typo or a mistake. So basically, liposuction and surgery, abdominoplasty, are the most significant results. So if there's a significant, you know, amount of fat that needs to be removed, I mean, liposuction usually removes like 2 to 3, maybe even 4 or 5 liters of fat. So obviously, Kybella is not going to achieve that. Kybella is for more minimal fat reduction and kind of fine-tuning body contouring. But it's also used to correct undulations or uneven texture after liposuction. So if they missed a spot or if there's an area where you have a little bit more leftover fat, it's great at kind of, you know, smoothing over that contour after liposuction. But coolsculpting, you know, lipo or sculpture, Kybella, these are all minimally invasive procedures that are not going to have the results that surgery and liposuction or abdominoplasty are going to have. But they're great options for the right candidate. So I wanted to just make that clarification because I think somewhere in the video I flipped the two and I said, you know, Kybella and lipo are the more significant results. Kybella definitely is not the more significant. It's the safer and the more kind of fine-tuning treatment, as if you want to think of it that way. The other thing that I wanted to mention, because I know some of you guys are going to have this question, because I said that coolsculpting, when you melt the fat, can cause skin laxity. Well, why doesn't Kybella cause skin laxity when it melts the fat? It does to a certain extent, but not as much as coolsculpting does. And I don't know if it's because you're not drawing the area to be treated into this suction that's stretching out the skin, or I don't know if because Kybella is melting the fat and recruiting a little bit of an immune inflammatory response in cascade. That's why you get a little bit swollen, especially under the chin area. When we treat with Kybella, there's a component of tightening of the skin that happens with Kybella. In fact, they were going to actually do some clinical trials through the FDA proving that that Kybella can actually stimulate collagen and help tighten skin a little bit. But with any procedure that's going to remove fat, skin laxity is always going to be an issue, because you can think of fat as like a filler. That's why plastic surgeons do fat transfer. So the opposite is true. When you remove that filler, when you remove that fat, the skin gets kind of deflated and get laxed and more wrinkled. So I see less of that with Kybella, and I truly feel it's because with the dissolving of fat using the deoxycholic acid, there's some inflammatory cascade and some inflammatory responses that increase the pathway for collagen synthesis. So you do get some tightening of the skin. So when we do body contouring, I rarely see, or I don't think I've ever seen, any increase in skin laxity after doing Kybella. I also am very careful with my patient and my candidate selection. If the patient has, like, say, a lot of abdominal skin laxity and they want to melt fat, I'll recommend either like a tightening device to go along with the Kybella, or I'll probably refer to my plastic surgeon colleagues for a more aggressive treatment that's going to address the skin laxity and the increased fat adipose tissue to be removed as well. So there is always going to be a risk of skin laxity when melting fat, regardless of the option. However, I feel like it's less of an issue with Kybella because of that. And then the other thing that I wanted to include, just because I'm neurotic and type A and want to be all-inclusive, as far as other treatments. So we talked about coolsculpting, we talked about liposuction, we talked about Kybella, obviously is what the video is about, but sculpture and some of the other devices that remove fat by heating it up, as opposed to cryolipolysis or freezing the fat like coolsculpting, these treatments do melt the fat. I don't feel that the results are as substantial, and they're very underwhelming. I've played with a lot of these devices. I've had a lot of them in my office, and there's a reason why I don't have them in my office right now. There used to be a treatment called Venus Freeze where we heated up the fat. Even though it was called freeze, it was like the weirdest name because you were heating up the fat and melting the fat, but it was called Venus Freeze. There is sculpture. There's a lot of devices out there that melt fat through heating the fat, but I don't feel that they work as well. That's different than thermage. Thermage stimulates collagen by having heat in a certain window and not going above that heating temperature that will melt fat. So I'm trying to think of all the questions that you guys may have, because it could be so confusing when you're reading about all these different treatments and why does one work better than the other, and how come you freeze the fat and then you melt the fat and then you have it at a low temperature or a high temperature. Why do some cause some laxity and some of them don't cause skin laxity? But there's a rhyme and a reason for everything. And if you guys have any questions, again, drop a comment in the comment section, because I want to be able to answer all your questions, because the more research you do, the more questions that you'll probably have. But I wanted to include some of the heating devices that heat and melt the fat through that mechanism as well. I don't feel that they work as well as Kybella or coolsculpting, and coolsculpting side effects just make it not a desirable treatment, especially to have in my office, which is why I don't have it. And then the other thing I wanted to mention is laser lipo, because you guys may have a question about that. Laser lipo is just kind of the same treatment as liposuction. You're just using a different instrument or tool. So traditional liposuction or tumescent liposuction, they use a cannula, which is attached to a suction, and it basically sucks the fat out using this cannula. When you use laser lipo, the results are pretty equivocal to liposuction. It's just a different mechanism in which it works. One's not better than the other. I've used both back in the day when I used to do liposuction in my office, and using the laser lipo, it basically heats up and melts the fat, and then you suction it out just like you would using a liposuction traditional cannula. So laser lipo, pretty much the same thing. Sculpture and some of the devices that heat up fat, I don't feel work as well. Coolsculpting is great at reducing fat, but the laxity and side effects are not worth it in my opinion, and I feel Kybella is the best of all worlds for multiple reasons, but is not going to be the treatment of choice if you have a lot of fat to melt. So that's kind of like the take-home message. Last thing I want to also include is paradoxical lipohypertrophy. What is that? What does it mean? And is it going to happen to me? What that means is when you reduce fat in one area, be it via liposuction or coolsculpting, there have been known cases and side effects where you get increased fat in other places. So how awful is that? Think about coolsculpting or doing liposuction on your abdomen, or you doing a BBL or a lipo fat transfer, and then you get increased fat in your arms or increased fat in your legs. That can happen. I have never seen it with Kybella. I don't think it's ever been documented with Kybella, which also makes Kybella one of my treatments of choice. So paradoxical hypertrophy of the adipose tissue, which is basically getting fat in other places after removing fat in other places. So don't really have to worry about that with Kybella, which also makes it, you know, a very desirable treatment. Okay, I think that includes everything. Thank you guys.